Dong Zhe is an ophthalmologist at Beijing Tongren Hospital with 20 years professional experience. Apart from the outpatient service, she performs almost 60 cataract surgeries every week. Since most cataract patients are senior citizens, their waning faculties of communication and understanding demand extra patience and skills.
Some elderly patients are mentally prepared. They will immediately undergo preoperative checkups after the diagnosis, but others may need to take some consideration. Since cataract surgery is elective, we must allow the elderly patients to get well prepared for the operation.
Beijing Tongren Hospital, with its leading specialty in ophthalmology, receives more than 10,000 patients a day. She's extremely busy right the way through her shift, getting through a huge amount of work. But she always has one priority.
We need to do our best to complete every operation safely and give treatment to as many patients as possible, but the premise is that safety comes first.
Tongren Hospital is set to build a few new branches in the suburbs of Beijing. It's hoped they will take some of the burden of the main hospital and provide more convenient and efficient medical services. At the end of 2019, there were over 3.8 million licensed doctors in China, an increase of 27% on 2015. A big number, but it still fails to meet the demand in the world's most populous country. China has always placed a great emphasis on health, with President Xi Jinping saying that prosperity for all is impossible without health for all. It's not surprising then that health is a major focus of China's Xiaokang project, or its aim to build a moderately prosperous society in all respects. Between 2016 and 2020, the government pledged investment about 141.5 billion yuan in more than 8,000 public health projects, such as the construction of disease control and prevention centers. The country's basic medical insurance covers over 1.35 billion people, a coverage rate of more than 95%. Hospitals in China's big cities are also taking responsibility in trying to bridge the health gap between urban and rural areas. Beijing Tongren Hospital regularly sent medical teams to support the development of public health care in rural areas. Those with severe eye diseases benefit from the hospital's charitable efforts.
I remember a patient was very excited after a cataract operation. She said she must meet the surgeon in person to show her gratitude. She told me that her grandson was 18 months old, but she had never seen clearly what the toddler looked like. I am touched and filled with a sense of accomplishment every time my professional skills render an opaque eye clear again.
During her missions to northwestern China's Gansu province, Dong said she noticed just how fast healthcare was developing in rural areas.
The local medical conditions in Huangshan County were not good during our first visit. In terms of ophthalmology, they had basically nothing. But I saw great changes there upon a recent visit in May. They have more medical equipment, such as surgical microscopes and phacoemulsifiers, and the overall level of medical care has also been significantly improved.
For many, China's fast and efficient containing of the coronavirus shows how the country's emphasis on public health is safeguarding its prosperity. Meanwhile, its vaccine development for the coronavirus reflects how much progress has been made in scientific research and technological innovation. The country has multiple ways now in which to expand its knowledge and innovation in healthcare and medical science.
We hold over 100 medical academic activities every year, which are centered on cutting-edge medical research fields and technologies. We also bridge medical research with enterprises to promote medical innovation.
For Dong Zhe, her job is more than medical treatments and operations. She supervises medical students during their clinical placements and to give lectures in residential communities.
Our lectures in the communities aim to increase the residents' knowledge about eye diseases and cataract surgery, telling them the cataract surgery is not horrific at all. The operation process is very mature, but the disease cannot be ignored. Patients should pay attention to it.
She believes that medical and nursing services can benefit tremendously from increased public awareness. And only when every patient can receive timely and quality medical treatment can society believe that prosperity has been achieved.